All right, definitely heart attacks, not fun. Very serious stuff. They can be prevented. Let's find out more about heart attacks. With us right now, Janice Steele, Primary Care Paramedic, Ottawa Paramedic Association. How are you, Janice?
Very good. Thank you for having me.
Good to have you here. And is this, what's the worst time of year?
Well, this is the worst time of year. We as paramedics tend to see an increase in cardiac-related events and heart attacks around the holidays, pre and post. Very stressful time for people. And credit card bills are coming in this month. That's enough to stop anybody's heart.
Yeah.
And also, as you say, the snow today, shoveling the snow can put a great deal of strain on a healthy heart. So
strain and the stress of it all too, because even myself, I look out first thing in the morning. I do have winter tires, but you wonder, can I make it to work? Is it safe? Is it so? That stress is going to be a major factor.
Exactly.
Of heart attacks.
Yeah.
Okay.
But in order to know about heart attacks, we have to understand what's happening during a heart attack. So,
of course.
So we'll have a quick little biology review. So your heart's muscular pump, and it beats about 70 times a minute, which is 100,000 times per day. So it's a really hard-working organ, requires a constant supply of oxygenated blood. And even though it circulates our entire blood volume through itself every minute, it gets its own blood supply from coronary arteries that you can see here. Unfortunately, as we age, these coronary arteries can become diseased. And what that means is these plaques can build up on the inside wall of the artery. Over time, that makes the artery more narrow, more rigid, and these plaques can actually break off into the artery.
Okay.
That's where the problem happens. So when the plaque breaks off, it triggers a platelet response, and the platelets are the things that form clots. Normally good in the rest of the body, but disastrous when it happens in an artery. It's like a dam, prevents that vital oxygen-rich blood supply from feeding the heart tissue. The cells start to die, your heart muscle starts to die, doesn't beat properly. You can end up in sudden cardiac arrest.
Wow. Okay. So obviously, I mean, this is. Heart attacks still can happen at any age, but you're more susceptible to it, I suppose, when you're
there's risk factors, right? And like any disease, prevention is key. So there are risk factors that sort of predispose you. Lifestyle choices that we make predispose you to this fatty plaque buildup. The good news is they're modifiable. So maybe as I'm running down the list, we can think, it's New Year's resolution. We can think of things that we can do to change this year. So some of these risk factors are like obesity, smoking, poor diet, lack of exercise, uncontrolled high blood pressure, poorly controlled diabetes, and stress.
Okay. What exactly does a heart attack feel like when you know that because sometimes you get chest pains?
Yeah, well, there's different signs and symptoms, whether you're a man or a woman. So we'll start with men. Men typically present with the textbook classic signs and symptoms. So there's often some sort of chest pain or discomfort, like a pressure, a heaviness, a vice-like squeezing, often very short of breath, sweaty, often sick to their stomach, and they have this referred pain that's sort of like predominantly left arm, shoulder, neck, jaw. Women, on the other hand, present with what we call a soft story. So their symptoms are a little more vague. They may still have chest pain, but it's often less severe. Oftentimes we see it's just a back pain or like an indigestion, sort of maybe a jaw pain that they think is like a dental emergency. And actually, with women, we find the number one complaint is weakness or fatigue. It's not necessarily chest pain. So that's a key message I'd like to send home to your viewers, that you don't have to be having chest pain, especially if you're a woman. So, trust your gut instinct. If you think something's wrong, definitely call 911.
I do find that interesting because a lot of people, obviously, you think of heart attacks, so you think, well, you need to feel a chest pain.
That's right, and then some women end up delaying seeking treatment because they think, well, I can't possibly be having a heart attack if I'm not having chest pains.
But then when do people maybe take it too far and assume that every ache and pain could possibly be?
Well, it's always best if you're unsure to call 911. We can come and diagnose you. So. So that's a good lead-in. So what should we do if you think you're having a heart attack? And the first thing you want to do is call 911. Don't phone a friend to discuss it. Don't Dr. Google and try to self-diagnose. Get help coming fast. Paramedics are highly trained medical professionals with years of schooling and lots of experience, and we literally bring a mobile emergency room to your door. We're trained to diagnose you as having one type of one of three types of heart attacks, and that's a STEMI, ST elevation myocardial infarction. If we diagnose you as having that type of heart attack, we initiate rapid transport to the Heart Institute, bypassing all the other hospitals, and that saves time, and time is muscle when it comes to your heart. So the second thing you really want, that's really important, is you want to take 2 81 milligram strength tablets of aspirin.
Okay.
So aspirin is a really neat drug. You can take it for fever, for pain, for inflammation, but the really unique property about aspirin, potentially life-saving property, is that when you're having a heart attack in that clot, it's an antiplatelet, so it stops that clot from getting any bigger.
Okay, what about, is it a myth that you should be taking aspirin daily even if you aren't experiencing?
Well, that's something that you
pains?
need to discuss with your doctor.
Okay, so
this is more for an emergency preventative. If you think you're having a heart attack, if you're having that chest pain or any of those other signs and symptoms, take 2 81 milligram strength tablets of aspirin. It will stop those platelets from sticking together, thereby stopping that clot from getting any bigger.
Okay. So obviously, if you fear you're having a heart attack or somebody is with you and they call 911, what's the best way for that person, either the person experiencing the heart attack or the person that's with the person having the heart attack, to prepare for your arrival?
Well, there's some things that you can do that we really appreciate. Turning all the lights on so that we can find you, turning the outside lights on, turning the inside lights on so we can see and assess you. If weather permitting and you have somebody there with you, send them out to meet us sort of as a waiver. They become our beacon sort of in the dark that we can pinpoint on your location and drive straight to you. And just so you know, like when we arrive in pairs. It's going to be fast and furious. We're going to ask you lots of questions about your history, signs and symptoms. And one of the paramedics will be doing your vital signs, your blood pressure, your heart rate. We'll be putting you on a 12 lead, which is an ECG, and that's how we determine if you're having that ST, elevation myocardial infarction. And then we can initiate rapid transport, as I mentioned, and also treatment. So,
okay, how many heart attack instances would you say calls do you receive?
It's so hard to say. There's so many paramedics in the city. I would say I probably have 1 chest pain call a day.
Really?
Yeah.
Wow.
So they're not all heart attacks, but you know, it's still best to call 911 and have us come and help you determine if it's something serious or not.
Definitely preventative measures are probably the best.
That's right.
Yeah. I know you love working. I know you love having a job, but probably
nobody wants to see us come to their door. That's for
definitely.
sure.
All right. So more information, we can go to Ottawa, or make that OntarioParamedic.ca.
That's right. Yep.
All right. Janice Steele, Happy New Year. Thank you for
being
being
here.
here.
Thank you for having me.
We appreciate your time. Coming up, how about this? Getting to room temperature is at the Gladstone, and we've got details next on Daytime.